Hello. We have a lecture on blindness and visual impairment. I'm Dr. Zeeshan, and we will continue this lecture. First of all, we have to see the learning objectives that we have is define blindness, categorize visual impairment based on visual acuity, explain the magnitude of the problem globally and in Pakistan, describe the epidemiological determinants of blindness, list the major causes of blindness, discuss the concepts of comprehensive eye healthcare, explain the prevention measures of blindness, state the role of national program for prevention and control of blindness in Pakistan. The next slide is blindness and the definition. According to the WHO, visual acuity of less than 3 by 60, according to the Snellen's chart or its equivalent. In the absence of appropriate vision charts by non-specialized personnel, we will go with the other definition of the WHO, inability to count fingers in daylight at a distance of 3 meters to indicate less than 3 by 60 and its equivalent. Snellen's chart. Uh, you can see this is the Snellen's chart, and this is most important chart that we usually ask. As we can see on the number one, the definition of blindness according to this Snellen's chart is a person would be able to read 20 by 200. That's the vision of just one word. The next slide, we have category of visual impairment. We have low vision and the blindness. You can see the visual acuity maximum less than, and the other one said minimum equal to or better than. The low vision would be 6 by 18 or 6 by 60. And the second one is 6 by 60 and 3 by 60. In blindness, as we have said before, 3 by 60 finger counting at 3 meters will be considered blindness, or 1 by 60 finger counting at 1 meter. Finger counting at 1 meter is 1 by 60, or no light perception, no light perception. Magnitude, if we will discuss about the magnitude of the problem globally, at least 2.2 billion people have a near or distant vision impairment. In at least 1 billion or almost half of these cases, vision impairment could have been prevented or has yet to be addressed. 80% of blindness is avoidable, 58% of them are greater than 60-year-old. This is one of the pie chart. As you can see in the pie chart, 39.51% is depicted in orange color, which is cataract, which is usually the major chunk of it. Then comes with 18.2, which is shown in the pink color, which is uncorrected refractive error. And 10.6 is the white color depicting the other category. 10.1 is the contrast cases, and glaucoma, there is one of the major portion of it. In the next slide, we can see a picture showing cataract, and it also shows healthy eyes and glaucoma. We have to understand that in order to, if we are reading cataract, we should be visualizing what is the pathology, and we can see. Usually these are asked in the exam and usually depicted in the picture. As you can see in the normal eye, the left-hand side, we have a dark black cornea, and which people, we can see it's not hazy and all that. In the cataract, you can see the whitest haziness, as well as in the other, on the right-hand side, healthy eyes, and there is glaucoma, is usually uh, glaucoma is defined as increased intraocular pressure. You can see the prevalence. We can see the prevalence in this bar chart. Household affluent, household medium, and household poor. In this bar chart, we can simply see is the on the x-axis we can see the cataract, and on the y-axis we can see 0 to 1.6. We can see the most household affluent is around less than 1.2 as compared to household which is medium income is crossing the 1.2 limit around 1.3. And the highest is among the household poor, just depicting how poor socio-economic class have higher incidence of care threat. The next slide is blindness in Pakistan. You can see the true prevalence of blindness was there for 3.4%, 95% CI, 3.1%, 3.7% confidence interval. The true prevalence of severe visual impairment and blindness, SVI were clear. That is presenting visual acuity of less than 6 by 60 in the better eye was 4.9%. 95% confidence interval 4.5% to 5.2%. Epidemiological determinants of blindness, age in children and young. Refractive error, conjunctivitis, trachoma, malnutrition, adult cataracts, refractive error, glaucoma, and diabetes mellitus. Gender, higher prevalence of trachoma, conjunctivitis, and cataract is found in women, leading to high prevalence of blindness in women. Leading causes of blindness. Malnutrition, infectious disease of childhood, especially measles and diarrhea, protein and energy malnutrition, severe corneal blindness, destruction due to vitamin A deficiency in first 4 to 6 years of life. Occupation, people working in factories, workshop industries are prone to eye injuries because of exposure to dust, airborne particles, flying objects, gases, fumes, and radiation. Social class, survey indicate that blindness twice more prevalent than in the well-to-do. That we have seen in the bar chart previously. Social factors, basic social factors are ignorance, poverty, low standard of personal and community hygiene, and inadequate healthcare services. Concept of comprehensive eye healthcare aims to ensure that people have access to eye care services that meets their needs at every stage of life. This includes not only prevention and treatment services, but also vision rehabilitation according to the WHO. Comprehensive eye health care refers to a holistic approach to maintaining and improving visual health. It encompasses a range of services and practices aimed at preventing, diagnosing, and treating various eye conditions and diseases. This concept emphasizes not only the correction of visual problems, but also the overall health and wellness of the eyes. The next slide, you can see the components of comprehensive eye health care. There are some key components of comprehensive eye health care. Regular eye examination. Routine eye exams are essential for early detection of eye diseases and vision problems. Comprehensive exams involve various tests to evaluate the visual acuity, eye alignment, eye pressure, and overall eye health. Vision correctness. Vision correction is this includes eyeglasses, prescribing eyeglasses, contact lenses, or refractive surgeries like plastic to correct refractive errors such as myopia, hyperopia, astigmatism, and presbyopia. Eye disease management, comprehensive eye health care involves diagnosing and managing various eye conditions and diseases such as cataracts, glaucoma, diabetic retinopathy, macular degenerations, and others. Treatment may involve medications, surgeries, or other interventions to preserve vision and prevent complications. Preventive care, educating patients about eye health and promoting preventive measures such as regular eye exams, UV protection, proper nutrition, and lifestyle modifications to reduce the risk of eye disease. Pediatric eye care, specialized care for children to monitor their visual development, detect any abnormalities early, and address conditions like amblyopia, lazy eye, and strabismus, crossed eyes. Geriatric eye care, addressing age-related changes in the vision and managing conditions prevalent in older adults such as cataract, macular degeneration, and glaucoma. Low vision rehabilitation, helping individuals with visual impairments maximize their remaining vision through aids, devices, training, and support services. Collaboration with other healthcare providers, coordinating care with primary care physicians, optometrists, ophthalmologists, and other specialists to address systemic conditions that may affect eye health, such as diabetes and hypertension. Community outreach and education, engaging in community programs to raise awareness about the importance of eye health, provide screening, and ensure access to care for underserved populations. 10. Regular eye exams and proactive management of eye conditions are crucial elements of this approach, ensuring that vision problems are detected early and managed effectively. Preventive measures of blindness, components for actions in national program for the prevention of blindness comprise the following: initial assessment, number second is methods of intervention. We have primary eye care, secondary eye care, and tertiary eye care. Primary eye care, methods of intervention. Most of the eye diseases can be diagnosed and treated at grassroots level, as we know it, primary level, by locally trained healthcare workers who are first to make contact with the community. That's where most of the diagnosis and investigations does happen. They are also trained to refer the difficult to the nearest PHC or district hospitals. Their activity also involve promotion of personal hygiene, good dietary habits, sanitation, and safety in general. The final objective is to increase the coverage and quality of eye health care through primary healthcare approach and thereby improve the utilization of existing resources. Secondary eye care involves definitive management of common conditions like cataract, trichiasis, entropion, ocular trauma, glaucoma. It is provided in PHCs and district hospitals where eye departments are established. May involve the use of mobile eye clinics. The advantage of this strategy is it is problem specific and makes best use of local resources and provides inexpensive eye care to the population at the peripheral level. This is one of the slides. We can see the entropion and ectropion of the lower lid. Entropion is inversion and ectropion is eversion. You can see in the middle is a healthy eye. Tertiary care, they're established in the state institutions or regional capitals and are often associated with medical colleges, have facilities and its board of the faculty and advanced surgeries like retinal detachment surgeries, corneal grafting, which are not available in the secondary centers. Other measures include rehab, including education of the blind in special schools and utilization of their services in their employment. Role of National Program for Prevention and Control of Blindness in Pakistan. Overall goal of the program is prevention and control of avoidable blindness, upgradation of eye departments of the hospitals in the provinces in terms of provision of latest ophthalmic equipment, capacity building of the eye care personnel, provision of the outreach eye care services, screening and surgical awareness raising, research and community development are the main objectives of the program. Thank you. That's all.